Hello, good morning, viewers. It's a pleasant Wednesday morning on the Now Streaming Show brought to you from the Advent Cable Network, Nigeria. It is a show where we challenge perspective and break stereotype. This morning, we would be looking at a very important health topic that has affected and is still affecting millions of men out there. But often this so important topic is not being given the desired attention. A focus would be on the awareness of prostate enlargement and prostate cancer. We will be discussing this alongside other national trending story for today. I am Godwin Ujiri, your anchor for today's show. But I will not be doing this alone in the studio. With me to co-anchor the show is
Okeizu, Somtochukwu. It's my pleasure to be with you this morning.
All right. A very good morning to you, Somto. It's always a nice time having you on set.
Thank you so much.
Because you have this way of spicing the show and not making it so stiff.
Thank you.
All right. With us in the studio also to do justice to our very important topic this morning is Dr. Sunday Olatunde. He is a clinical pharmacist and also a fellow of West African Postgraduate College of Pharmacists. Doctor,
Thank you very
are
much.
much welcome to Now Streaming.
Thank you very much for having me.
All right.
One more time on the show.
On the show, because I could remember the last time we were on set together. It was a whole lot of lessons for me especially and also our viewers. And I want to trust that this time around, looking at this very important topic, you have a whole lot to give to our viewers this morning.
Yes. It won't be different.
All
by
right.
the grace of God.
All right. Our viewers, remember you can be part of the show by calling the number showing on your screen and sending your comment via our various social media platform. We are now in our discussion segment where we are looking at a very, very important topic this morning, and it is on the awareness of prostate enlargement and prostate cancer. And stay with us in the studio is my co-anchor, Mr. Somtochukwu Okeizu, and also our guest who happens to be a doctor, Dr. Sunday Olatunde. So, Doctor, I think it's high time we look at this major focus.
Okay.
Prostate enlargement and prostate cancer is something that have been with us for a very long time. Unfortunately, it affects the men when you talk about prostate, and it's something most times people don't really discuss. So please, can you help us? As a layman I am, can you help me to understand what prostate enlargement and prostate cancer is?
Okay, thank you very much. We are on the crux of the matter. You see, prostate enlargement. Let's first understand that a prostate is a walnut-like. You know what they call walnuts? The shape of a walnut is a kind of gland. We call it prostate gland, just situated a little below the bladder. We understand what a bladder is. When the kidney produces urine, the urine is stored in the bladder. Okay, just under the bladder is the prostate, as it's been shown on the screen. The prostate gland. That prostate, at a little advanced age, like age of 40 and above, you find it because of influence of genetics and the influence of high level of testosterone made available in its environment. It starts expanding in size, and that is what we call prostate enlargement. And when that enlargement happens, it interferes with the free flow of urine. It interferes with how easy you can empty the bladder. It also interferes with how you can, allow semen to come out of the urethra, because the prostate is on the way. where which the semen and the sperm cells can get out of the urethra. The urethra is the opening through the penis of a man. Okay, so the prostate is on the way. In fact, the ducts, something like a pipe that connects seminal vesicle into the urethra, passes through the prostate gland. Also, the ducts, which is the urethra that emanates from the bladder, through which urine is passed and is exited out of the tip of the penis of a man, is also through the same prostate. So when prostates get enlarged, what you find is that it exerts pressure on the opening of the urethra, and by that it interferes with the free flow of urine from the bladder, also interferes with the free movement of sperm cells coming from the testes, and so on and so forth. And that is influenced by aging. Okay, and that's why we say when one is getting to about age of 40 and above, that's when this thing normally starts, enlargement of the prostate. And the essential or the cause of this enlargement is actually not known, only that we feel that increase in testosterone, the presence of testosterone, which is a male hormone ordinarily that is available in that area, has has caused the increase in the size of the prostate, or the age, or the genetics of the person. However, that's what we call prostate cancer. And good enough, on the 4th of every February was the day that is actually set aside to celebrate or to mark the World Cancer Day. And one of the cancers that we have is prostate cancer. And prostate cancer is only happens in men, because women don't have prostate. So we have taken a look at what prostate is, just minimally. Then we take a look at what prostate cancer is. We know that cancer is an abnormal growth of cells of any tissue or any cell or any organ whatsoever. Meaning that cancer can happen to any part of the body. It can happen to the throat, it can happen to the lungs, it can happen to the skin, it can happen to the blood, it can happen to anything, to the liver, to kidney, to whatever. Okay, so abnormal growth of cell that does not have any known cause is what we call cancer. So when it happens to the prostate gland, we call it prostate cancer. This can be with enlargement or without enlargement. The prostate cancer can happen even when there's no enlargement of prostate gland. Are we getting that? Okay, so that's what we can call prostate cancer and prostate enlargement. They are different. They are not the same. Their management are also different. However, in many cases, what I'm saying in essence is that when prostate is enlarged, we call it prostate enlargement. Whether it is enlarged or not, when the cells start growing abnormally, we call it prostate cancer.
Okay, this is really insightful.
It is indeed.
Thank you so much. So, I quickly want to ask these questions, although it's going to come in two forms anyway. So, the first I want to ask is, what are the signs and symptoms a man might experience with an enlarged prostate? Just like you said, what are the signs and symptoms? Also, how can he tell if it's something mild or very serious? That's one. Then secondly, when you were speaking, something just quickly came to my mind. So it's like a question. Before now, it seems like this issue of prostate cancer hasn't been on the rise. It seems like it's now that it's becoming so rampant. And so I want to ask, what has happened so far between then and now that it seems like it's now, this thing now is like it's happening to everyone? That is this question now, and the one I asked, what are the signs and how will you know if it's mild or serious?
Okay, let me quickly start from the last question. The prostate cancer seems to be on the increase, not because it's not been there. What happened is that awareness and the means of spreading information is far more effective now than ever. You will agree with me that the other time that there was fire in California, as it was happening, so we are aware of it here. Before, if such a thing happened, if we are going to hear about it in Nigeria, it may take 1 year or 2 years, or it may take only when somebody travels to that place and the person comes down and comes back home and is telling us the story. That can take 2 years, 3 years, or 4 years. Sef. But this time around, if you see anything anywhere in the world, you get to know, because the world is now a global village. So that makes information to be well spread. Also, there is the global population growth. Of course, when you are 50 people, the incidences will not be the same thing as when you are 100. And the incidences will not be the same thing with when you are 500. So there's general global population growth, which is now making more cases that were almost not known before, now becoming more known. And when it is known, it is easy to be spread. And when you spread, everybody knows about it. But it has always been like that, because prostate has always been a part of our life. How will you know the degree or the intensity or the severity of prostate enlargement?
And also signs and symptoms.
And we'll go to signs and symptoms, because you can only determine that from the signs and symptoms, and the severity of signs and symptoms. For example, I said when a prostate is enlarged, if it's just mildly enlarged, what happens is that when it is enlarged, like I said the urethra that is coming from the bladder, it has a duct. A duct is like a pipe, which is the urethra, through which we urinate. And that duct passes through the prostate gland. If the enlargement is mild, the pressure on that duct is mild, because the duct is going to close. And it's going to be mildly closed, meaning that that person will still be able to urinate, but may not be as freely flowing as it was before the prostate starts getting enlarged. That is at a mild level. But if it is, severely enlarged, of course, you know that thing can close the entire passage, the duct, completely, because it is severely enlarged. When that happens, the person will not be able to urinate. In such situation, you see that in the hospital, they will pass in catheter. They want the person to urinate by all means to make sure they expand the space, which the prostate gland. I wish they can give us the picture again.
Okay, please,
because
Director, please, can you project that picture one more time? All right.
Not this.
The first one you projected.
Okay. Are you seeing what is labeled as prostate gland here? Can I move to that picture and show it?
No,
I will not be able to.
Okay,
you can see the prostate gland here under the bladder.
Yes.
You are seeing the bladder.
Yes.
You see the prostate. You see something like a wire. That is the duct that passes from that bladder through the prostate gland. If that prostate gland is enlarged, it has divided it into two now. Are you seeing it? If it is enlarged from both sides, it will close that duct in between. And it is through that duct that urine comes from the bladder. So if it is moderately enlarged, the closure will not be complete, will not be total. Urine will still be passing gradually, but it will not be so freely flowing like it used to be. That's a mild level. But if that thing continues to enlarge and is severely enlarged, it can close that duct completely. When that happens, you will feel that you want to urinate, but nothing will come out. You will be pressed, but nothing will come out. And that's a severe level of a prostate enlargement. So let's take a look at symptoms, because it's very important. And everything that you can call symptoms of a prostate enlargement is derived from that closure of that particular duct. So let's take a look at it. Number one is that somebody could feel urgency, urinary urgency. You feel that you want to urinate, and it just starts abruptly. No. And you go to urinate. When you get to urinate, just small urine will just come out. And nothing is coming again. However, when you urinate and you have emptied the bladder completely, you will feel it. You will feel relieved. Okay. Nothing is coming, but you are not feeling the relief because there is still urine inside that bladder. And as a result, you see the person, we call it urinary urgency. You go to the toilet, small thing come out. You come back. Before 30 minutes, you are pressed again. You go. You still urinate, small thing. When you come back again, before you stay for 30 minutes, you are still full. Again, you want to go. You will see that kind of frequent urination. You see, I said urinary urgency. Number two is frequent urination. Another one is painful urination. You know that when the duct is closed to some extent, urine will be using force to come out of the bladder, to come out of the manhood, the tip of the manhood. So you see the person experiencing painful urination. Another one is that the person may find it difficult initiating urination. You are pressed, you want to urinate. You get to the bathroom, you start stretching to urinate, nothing is coming out. After like few minutes, maybe 5 minutes, urine starts coming out. You can also experience a situation where you have been able to initiate urinating. However, along the line, you are not completely empty. That the bladder is not completely, but urine stopped. And when you still struggle a bit to still say, let this thing come out now, another one, it starts. So you see, stopping urinating in the middle of urinating and again starting it again. It's also another symptom. In some cases, you could see the thickness of the urine that comes out of a man's penis. For some people, it's as thick as this. For some people, it's very thick and it comes with a certain level of force. And you will even remember that when we were younger, it used to be very forceful when you want to urinate. But as you continue to grow older, you will see that that force will be reducing. The thickness will be reducing. The person that has a prostate enlargement, you see the thickness of the urine stream, we call it, will start be kind of tiny like this. It will not be as large as it used to be when we were younger. Another one is the person could have something like a blood stain. Because when the prostate is enlarged, there are many things that can make prostate to be enlarged. Infection of the prostate can make it to be enlarged. However, prostate enlargement that is as a result of aging and occasioned by increase in testosterone and androgen could also make the prostate to be enlarged. Whatever it is, when prostate is enlarged, the person could have blood in the urine and so on and so forth. Those are the possible symptoms you see with prostate enlargement. You could also have sexual dysfunction. You see an individual that is having sex. I hope you guys are not too young to be discuss sex with. For some of us, we are married and we can talk about sex. What happened is he's also married.
Very soon.
What about you?
Very soon.
Very soon. So I will then I can determine the extent of how I can take you on this matter now. Sexual dysfunction is another symptom. Okay. You see an individual that is having sex and he ejaculates. Nothing comes out. But he has ejaculated. Yeah. Of course, when a man ejaculates, there's a sense of satisfaction that he has. He has done that, but nothing comes out of his penis. Because the duct through which the semen will flow out has been blocked by the prostate. Do you understand now? So in such situation, such person can experience what we call sexual dysfunction or retrograde ejaculation and so on.
All right. Thank you so much, Doc. A whole lot of issues there, and I think our viewers are listening and they are following up. We still want to encourage you to send in your comments. The doctor is right here to give answers to all of those your pressing issue. All right, Doc, back to you now.
Yes.
It's so unfortunate for me as a person that informations like this often as important as they are, but they are rare.
Yes.
So I always see it as an opportunity to learn. I have a neighbor of mine who is late now, and he died of this same
prostate enlargement or cancer?
No, I wouldn't say it was cancerous.
Okay.
But his health was poorly managed.
Okay.
Although he was taken to the hospital, and that catheter you spoke of
catheter
was placed on him. The pain was at that point so much, and he requested that the children brings him back home.
Okay.
Yes, and with all of that, family became so weighed out.
Yes. And
one thing leads to another, and he finally gave up. Yes. And I just want to know, at what age should men start getting themselves checked of any of these prostate issues?
Okay, thank you. Because in any health education, prevention is always a cardinal point. We are here because we want people to know so that they don't fall victim of being a patient of prostate enlargement or prostate cancer. So by age 40, it's expected that an individual should start taking issues of prostate health serious. A man, for example, for that matter, not a woman. Women don't have prostate, therefore they don't have prostate enlargement, and they cannot have prostate cancer. But when it is 40 and because we said predisposing factor to prostate enlargement will be genetics and age and probably lifestyle of the person. So by age 40, it is expected that the person takes issue of prostate health seriously. And how do you take it serious? It's not by assumption. This a structure of the body. When it is growing bigger, you won't know until when it has started causing those symptoms, those problems that we enumerated. Therefore, you cannot know, and you don't want anybody to get to the level of symptoms, because by the time you have gotten to the level of symptoms, you have already got prostate enlargement, and we don't want anybody to get to that level. So symptoms will not be the highlight of our discussion. But prevention, what can you do? Okay, since you will not know when it's growing bigger, it is expected that when you are 40 years and above, or even for those who are 35 and above, you should do what we call prostate examination once in a while, because the size does not just increase abruptly, except when it is a case of infection, where which common antibiotics can take care of some of them. Are we getting it? Are we getting that?
Yes.
Okay. So it's not just a case, except when it is a case of infection that makes the size. But if it is a case of this prostate enlargement we are talking about, you will not be able to tell. You don't want to wait till when you have the symptoms. So what you will do is to once in a while, at least once in a year, because it grows gradually. So if once in a year you do prostate examination by one, maybe abdominopelvic ultrasound, a scan of stomach and the pelvic region like this, it will report the size of your prostate, and you'll be able to know whether it is normal or it is not normal. In that same test, if you do prostate specific antigen analysis or assay, that is, they collect a sample of your blood to see the extent of enzyme called prostate specific antigen, which is produced by the prostate itself. When prostate is under pressure, it normally produces it in higher level, higher than what should ordinarily be. If you run that kind of test, you will know whether your prostate is under pressure. And if you do that once in a year, before prostate gets enlarged to the extent that it will start causing the symptom, you will know. Because in the case of structural problems, issues of anatomy of the body, for example, diabetes is related to issues of anatomy. High blood pressure is related to issues of physiology and anatomy. And many of them, they don't have cure. Because you can't change the particular organ or tissue that is involved. That's why you see that they don't have cure like that. The issue with prostate also will not have cure because it's affecting a structure of the body. But when you detect it early, you can take some certain treatment that will make it to never get to very enlarged level, to the extent that you start having the symptoms. And some of them could just be as simple as you taking pill, some little pill, or some everyday medication to keep the prostate at its own present size. But if you don't do medical examination once in a while, or medical checkup once in a while, you won't be able to get to know that your prostate is increasing in size. So apart from that, diet is important and lifestyle. But let's just limit it to let me make mention a little of a diet. Diets that are rich in antioxidants are very good for leafy vegetables, that's grains, fruits. They are very good in antioxidants. Some supplements such as selenium, such as zinc, such as vitamin D, they are good for one to get level of moderating the function or the size of the prostate. So those ones could be okay. Not smoking, not doing alcohol is very, being physically fit is also very important, because when you accumulate so much of body weight, you can also provoke increase in the size of the prostate. So when you do all of that and you do your medical checkup regularly, as regular as once in a year from age 40, you will be able to know if your prostate is increased. For example, if you check this year, it may be normal. If you check next year, it may have increased a little. When they cite that increase, they may not even pick, place you on any medicine. But by the time you check another time, if the increase is now progressive, that is, another level of increase has also been seen, then you now know that this person, if you leave him, he will cross the line. Then you can place him on medicine at that level, and he will not get to the level of the symptom. Of course, you know that at that level of symptom, things have been going wrong already. So that's how we can.
All right, Doc. Before my co-anchor would take the next session of question, we have a comment from one of our viewers. It's coming from Mr. Eze from Abuja. He said, "I heard that tall men may be more likely to develop prostate cancer." And he said, "Explain." And could it be genetic? Then he also said that does frequent ejaculation reduce the risk for prostate cancer?
Okay. The issues with tall men and the issues with frequent ejaculation are postulations.
Okay.
And I want to believe we understand what postulations are.
You should break
They
it for
are
our
postulations are scientific assumption based on observation, but does not have empirical evidence.
Okay.
Should I come again with that definition of postulation?
I think we get that.
They are scientific assumptions based on observation, but without empirical evidence. For example, let's say we take a look at how many patients were managed in a center like National Hospital Abuja for prostate cancer, and we see that 70% of them are tall. 70% of the people we managed are tall. Only 30% are short people. That does not have empirical evidence, but by observation, we can say, okay, it's like more tall men come down with prostate cancer than short men. But you cannot say because you are tall, you must have prostate or you will have prostate cancer. Do we understand?
Yes.
We will now have to link the genes of the tall men, whether it is their gene that is relevant to that, or it's just that in that particular society, many of them are tall and many of them come with prostate cancer. Do you understand? So there's no empirical evidence to explain that. It's just by observation. It's a postulation. You cannot take it for empirical evidence. Do we understand what I mean now? So it can be at the level of observation. Say, okay, we observed that, but this is not, you cannot generalize it. Something that have empirical evidence is something you can generalize. Say, because of this, it will be like this. But in this case, that is a postulation. You cannot say outrightly that that's how it is. The same thing with frequent ejaculation. It is believed that when you commonly engage, there's something we call in science use and disuse or disuse atrophy. In a situation where which an organ that is supposed to be performing a certain work, if you don't allow it to do that work, it starts swelling up. That's where that perception is coming. Use and disuse atrophy. One of the things that, let's say we talk of what does prostate gland do? What does it? In the body, prostate gland does not make us to be alive, but it matters to fertility. And that's why, okay, let me put it this way. In one of the things that prostate gland will do for the body is that it produces, this is a part of the semen. You know that semen is different from sperm cells.
Yeah.
Okay, now that we get that, since semen is different from sperm cells, the sperm cells are produced from the testes, but a part of the semen is produced by the seminal vesicle, which is on the way before you get to the prostate gland, and another part of it is produced by the prostate gland itself. If you have sex regularly, you will engage the prostate gland more regularly. It will perform its work more regularly, and it will also slim down because it's working like your own body too. When you are working, you are slimming down, you are losing weight. But when you don't allow it to do the work that it's supposed to do, it is believed that it can start, unnecessarily being, plumpy.
Yeah.
And in that case, the size that is increasing is going to be impacting on the duct You know that duct? That duct and the duct that connect the seminal vesicle, they are the center through which the symptoms of prostate enlargement is produced. So in that case, you will see it. You see urinary urgency. You will see difficulty in urination. You will see painful urination. You will see starting urine and stopping, and so on and so forth, because it's around the bladder and all of that.
With what you said, seems like this assumption seems to be scientific. I don't know.
No, it's not scientific. A scientific conclusion has empirical evidence.
Yes, okay.
But postulation is as a result of observation, which may not have empirical evidence.
Okay.
All right. Just before you ask your question, we have a comment also from a viewer. It says, "Good morning, doctor, and thank you for today's teaching. I have just few questions to ask."
Okay.
He said, "Please, are there any dietary changes or supplements that can help prevent prostate cancer?" That is one. And he also says, "Are there any physical activities that can help to manage the symptoms?" That is two. Then thirdly, he said, "Also, how can one reduce the risks of prostate cancer or slow its progression?"
That's exactly what we are saying. Let's talk about slowing down the progression. Then we'll talk about the kind of physical activities. It will be good that, let's take a look at predisposing factors to prostate enlargement or prostate cancer. Number one is genetics. The gene that exists in a person from his family line, which makes him to be susceptible to prostate enlargement or prostate cancer. Second one is aging. When we're growing older, our prostate tends to start increasing. It is in that order. When we talk of predisposition, in that order, the first one is genetics. That person is genetically predisposed. The second one is aging. Those two things, you can't change it. You can't change your age, neither can you change your genetics. Yes. But you can still grow older. If your genetics is not so strong for prostate enlargement or cancer, you may not come down with it. Are we getting it? Yeah. However, there are some lifestyle that can be adopted. Even if you are genetically predisposed, or when you are aging, there's some lifestyle that can be adopted that can help either to slow it down or to reduce its progression, like the person rightly said. What? One, supplements. Two, diets. And I said diet that is rich in fibers, in antioxidants, such as vegetables and fruits. And such fruits mostly are green fruits. There are fruits that are, they can easily ripen. And when they ripen, they don't have enough antioxidants as those who will not be such ripen with a lot of, antioxidants. For example, you will see that cucumber may not ever, ripen. Yeah. Anytime you hit it, it's that green. Yes. So those kind of fruit. But you can also see carrots. Carrot is like that from beginning to the end of its life. Okay, carrot can also do very well. Garden egg can also do very well because that one even has some level of zinc, which can help. So those ones can help slow the progression or help postpone the time that a person will have come down with prostate enlargement or cancer. For example, when you say somebody will have come down with it at 45, they can help postpone it to like 50 or 50 something. And it may not be so severe if you are the type that have adopted that kind of lifestyle. Okay. So also being physically active is very important. Of course, you know that as a human being, when you are not physically active, you have tendency to add weight. And as you are adding weight, the weight is all over your body. When you say add weight, your hand is getting bigger. Is that not?
Yes.
So your internal organs too are bigger. So prostate is one of the glands that can also be bigger when you have added so much weight. And when it's bigger, it will be impacting on the free flow of urine through the urethra that emanates from the bladder. Are we getting that now? Right. So if you adopt being physically good and fit, if you adopt the kind of diet and you reduce fatty food, fatty food can as well make you to also blow up. So if you reduce all of that and you take supplement like zinc, supplement like sulfur metal, supplement like selenium, supplements like beta carotene and the rest of all of that, they can help slow down the progression of prostate enlargement.
All right, viewers, please still remember you can be part of this show by calling in the number showing on your screen. The doctor is right here in the studio to give answers to all of those your germane health issue. All right.
Okay, sorry, before we move on, the question from the first person,
Okay.
we didn't do justice to that question. I think I only answered 2 or 3. There are about 3 questions there. I answered 2. I think so. Can you read the question again?
Okay, from the first it says, I heard that tall men
we answered that.
Okay, could it be genetic?
Yes. In fact, you see the predisposing factor that I just read out. The first one is genetics. The second one is age. The third one is lifestyle. And it is in that order. That's the order of the predisposition of how a person, you can be growing old. If you don't have genetic predisposition, you may not come down with prostate enlargement. This means the very first thing you think of is genetics. Second one will now be aging. Third one is now the type of lifestyle you have adopted. In terms of their influence on whether someone comes down with prostate enlargement or cancer, the least is that lifestyle. The second to the last one is aging. And the first one is genetics.
All right, Somto.
Okay.
Yes,
as you speak, a whole lot of questions just
coming.
Yeah, I'm telling you. So I'm just going to just quickly ask them and
Yes.
then ask the questions that
Okay,
we
go
have on the
ahead.
show. Okay. The first thing I want to say, some of these supplements that you mentioned, when this prostate is mild,
Yes.
is it possible for it to reduce back to its normal shape? Like, is it possible for it to go back to its original size? Like, are there drugs that when one recognizes the symptoms on his mind, say, are there drugs that can make it go back to its normal size? That is one. Secondly, I have a friend that urinates very frequently. Is there a case where the person urinates very frequently and then urinates well? Is there something like that? Like, for somebody that, I think 30 minutes is even too much. This person urinates, like, before you know, he's urinating again. But what if that person urinates freely and well? Is there any scientific explanation to that? That's to 3. It's this prostate gland. You said it's not a vital organ that we can live without it. So is it possible for it to be taken out if one decides that it wants it to be taken out? That is one. Also, you mentioned smoking. Sorry, you mentioned smoking.
You will need to come again so that we take it one after the other.
No, these are just questions that
I
come
don't
into
forget,
my head. Where okay, should I just?
Come again. Just take like 2. So
okay, I said, is there any drugs that can reduce it back to its normal stage when it is mild? Then secondly, this frequent urination, is there a scientific explanation to it, even when the person urinates well?
Okay. For whether there are medicines that can make it to go back to its normal this thing. Prostate enlargement is managed with medications.
Okay.
Except when it has become so severe that surgical removal of the prostate is now recommended. Supplements will not bring the prostate back to its normal size, but may slow down the progression, because you know that the progression is what tells about the severity of the symptoms, and the severity of the symptoms is what tells whether the prostate enlargement will be life-threatening or not. Of course, if somebody can no longer urinate, that person is as good as gone, except catheter is quickly used or the person goes into dialysis straight. It can easily even destroy the kidney, because when you have the urine well accumulated in the bladder and it's not expelled, it can spread infection to the kidney, and the kidney can pack up from there. So supplements will not reverse it to the extent of becoming normal, but they can slow down the progression. So medicines, I will not want to mention their names so that people don't go into self-medication, can help, but none of them can keep the prostate at its original size without you taking them continuously. That's why I say it does not have cure, like high blood pressure and diabetes. Prostate enlargement does not have cure. If anybody is telling you that it has cure, the person is lying. And that's why you see that those who are on prostate enlargement medicine, they continue to take. Even if they stop for a moment, eventually later they will still need to take it, because the increase in size is progressive, and the drugs cannot, without the drug, you cannot just take a medicine, reverse it, and you stop the drug, it will still grow back again.
Are these drugs, are they expensive to get?
Some are expensive, some are not expensive.
Okay.
So you have a little more.
How about the urination?
Yes, the scientific explanation to urination. One, let me start from your urination. The frequency of your urination is directly proportional to the extent of fluid that you take in. If such person is taking fluid frequently and in large volume, that person will urinate more frequently, because when the bladder is filled to a certain extent, it sends through the spinal cord, it sends signal to the brain, and the brain feels that okay, the bladder is full at its own to the level with which urine should not pass. Then the brain will now release some certain chemical. That chemical will contract the bladder and open the muscle. We call it the detrusor muscle and the sphincter muscle. The muscle at the base of the bladder will open. Then the urine will be forced out. Then the continuous production by the kidney will continue to fill the bladder again. So as much as you take so much water or fluid, fluid can be water, it can be water from another thing that you take. For example, if you take juicy fruit that is so watery, you can also pass urine out. Are we getting it? Yes. So the first thing is that your urine will be directly proportional to the frequency of your urine will be directly proportional to the quantity of water that you take in. However, when you now take moderate level of water, I will now see yourself urinating frequently. That is considered as a medical issue that you may need to investigate what can be the reason. And what are those things that can make someone to urinate more? One, diabetes. If the person has diabetes, he may be urinating more frequently. Two, if the person have a bladder infection or incapacity of the bladder, he can be urinating frequently. That kind of bladder, it will not even wait till when the girl is full to that before it starts sending signal, and the brain will not send it. It will not urinate. It's a small thing that will come out too. But before you know it, another 30 minutes, bladder infection or bladder incapacity or disease of the bladder can cause it. Disease of the prostate, like we are discussing, can also cause it. The disease of what again? Urethritis. That's infection along the passage of the urine. It can as well cause frequent urination. Infection generally, diabetes, and so on and so forth. Those ones can cause frequent urination.
Doctor, so many answers have been given, and a whole lot of questions that we have outlined here for you. In the course of you doing an explanation, you've done justice to most of them.
Thank you.
But we would be sticking to some of the questions that some of our viewers have sent in the course of our conversation. And one of them is saying that I heard that you may also have an increased risk if you had sex with 30 or more women. Is this true? That is his question. And then the second says, are there NGOs that provide subsidized tests for prostate? Because the test is quite expensive. Then thirdly, before you respond, it says, is it true that masturbation is good for reduction since it can reduce stress and contribute to a healthy heart? Since most men fall asleep more quickly and sleep more deeply after sex or masturbation.
Okay, thank you. Even though I don't know whether I can remember all the questions at once.
Okay, I think let's take it
one after the other.
Yes, sir. Okay, the first one again goes to say, I heard that you may also have an increased risk if you had sex with more than 30 or more women.
Okay, yes, it's not true. At the same time, you cannot say it is false. an average tissue or organ of the body that is overused will easily, lose its function. Like an individual too, if you are overworked, you become sick yourself. Is that not?
Indeed.
The same thing that for prostate gland must not be overworked, because that could be considered as being overworked. And being overworked can make it to develop any kind of disease. Like individual too that is stressed can develop high blood pressure,
Yes.
can develop diabetes, can develop cancer. Stress can be a bedrock for so many things. The same thing that if you overuse that organ, it can also develop so many things. So that cannot be said to be an empirical evidence, but by observation it can happen, because an overworked overused prostate can develop any disease condition.
All right.
So second of them, are there NGOs? There are some NGOs. Yes, there are some NGOs, but how available and accessible they are, I don't know. But I've seen some NGO that take advocacy about prostate enlargement and cancer, and they help people when they want to run the tests and all that. But how accessible they are, I don't know.
All right, then the third one. Is it true that masturbation is good for the reduction, since it can reduce stress and contribute to a healthy heart, since most men fall asleep?
Thank you. I've got that question before you finish it. It still falls in the realm of observation and postulation. There is no scientific evidence that supports that masturbation reduces the size of the prostate.
All right. A whole lot. Somto, do you still have a question?
Just personal questions.
It's fine.
Okay.
It's fine.
All right. So as I was asking earlier on, you said smoking also could result.
Yes.
Smoking could also result to it. So this is just a question asking as a health professional. We all know the effect of smoking
And drinking too.
Okay.
Yeah,
Is it? I don't want to talk on Dre. I just want to stick to smoking. But why is it not possible for the government or the health probably establishment like the Ministry of Health to place a ban on such a thing as smoking, just as they did to cocaine and other kind of drugs? That is that. Then you've answered the other question of we can live without it, so one can have it taken out. Then lastly, when we say something is genetic, is it not possible for it to have a stop and not pass on to the next generation? Yes.
Okay. When we say something is genetic, it can be passed to the next generation by a recessive gene that is not dominant, meaning that the next generation may not have it because the gene that pass across is a recessive gene. But if it is a dominant gene, the person may come down with it. And that's one of the advantages of getting married from outside your family circle. If you get married in your family circle, you are likely going to pass defective genes. That's genes that carry diseases easily. But when you get married outside your genetic and your family circle, you are likely going to get a mixture of genes. And you may, by luck or by providence, to just get a gene. For example, let's say you are a man, you carry the gene that may have prostate enlargement issue. You marry a woman where there's no prostate enlargement in their family. Your male child may inherit more from your wife, and by that child will not have that gene that will produce this thing. That's one of the advantages of marrying outside your family circle. So the same thing with gene, but when it is dominant, you come down with it. When it's not dominant, it can be recessive, like in the case of that crossbreeding from two families. The person can just not have it. Then there is
the smoking.
The smoking is not directly linked to it, but social life that people adopt may make them susceptible to different disease conditions. Smoking is one of them that can make you susceptible to so many disease conditions, because the smoke you put into the system is an alien to body system, and by that it can make anything to go wrong. Do you know that if blood is not supplying very well to the tissues around prostate, that's they are supposed to be well supplied, but they are not well supplied, because inside blood is where you have the nutrients, oxygen, and the food to supply a cell to work well. If the organ or the tissue is not receiving that, it can start misbehaving. It can even come down with cancer. It's not impossible. So what we are saying in essence is that anything that can make the body to malfunction can also provoke another disease like the prostate enlargement and alcohol.
All right. Thank you so much, Doctor. It has been quite an exciteful time with you on the set. But lastly on the show, I just want to know, is there anything else you would want men to know about their prostate health generally?
Yes, generally. Thank you very much. And this is a very good time for me to, because our discussion did not really so much center on prostate cancer, yeah. Even though I define what prostate cancer. That's cancer generally, and when it happens to the prostate, it becomes prostate cancer. And it may not be with enlargement, just that the cells of the prostate is now developing or multiplying in a different, in a mad way, let me put it that way. And that starts putting so much pressure on the person. Symptoms that you can see when somebody is having prostate cancer is the person could be having blood stain in the urine. You can be having painful urination. The person can also be having blood in the ejaculate. Somebody that have sex and ejaculates and the ejaculate is what comes out, the semen and the sperm cell. In this case now blood stain. That person could be having it. The person could be having pain around the waist like this, or pains in the bone. Okay, those are possible things you will see. When you now correlate that with whether genetics in their family, somebody has got prostate cancer before, or you correlate with age, that person is 40 years and above, or far higher, you will see that that person may need to be sent for prostate cancer screening. How do you diagnose prostate cancer? It's essentially through assay of prostate specific antigen. 1, 2, appropriate scan that can tell the situation of the state. Then there could also be MRI to scan the prostate. Then there could be biopsy. Oncologists or those who are in the department for urology can open the person up, cut a part of the prostate and take it to the histopathology lab and see whether the cells of that prostate, they are cancerous. So you can get to that level, and when you do PSA through the blood too, you see that the PSA will be well elevated. It will be high. Those ones can be used to diagnose whether the person has prostate cancer. What are the treatments available for prostate cancer? 1, depending on the situation, a prostate cancer that has not metastasized, that has not spread from the prostate to other surrounding tissues, can easily be removed. And when you remove the prostate, the cancer is taken care of. Okay. The person may have problem having sex. Like I said, the fertility is the cardinal function of prostate, not life. Somebody can live without it, without issue. That person may not be able to copulate or to produce more children. So you value that and see, and you remove the prostate. In some cases, chemotherapy can be an option if it has been an advanced stage of whatever. Or you can also do what we call ADT, androgen deprivation therapy. Of course, that testosterone and androgen, where we said they feed prostate cancer. You can deprive that area and that region of hydrogen and be able to stifle the cancer cells of the prostate. I want to quickly encourage everybody to take their medical checkup. Very, very important, because we are losing so much when we lose a healthy individual in the society.
Wow. All right. Thank you so much. It has been quite insightful, and it seems as though I've been in a health class since we started the show. Our viewers, and especially all the men out there, remember, early detection is the key for both prostate enlargement and prostate cancer. Do not delay. Talk to your doctor today. On this note, I want to say a very big thank you to my very esteemed doctor in the studio, in person of Dr. Sunday Olatunde, and also my co-anchor for piloting the ship with me, in person of Mr. Somtochukwu Okeizu. Viewers, however, so much to dish out, but we have actually run out of time. This is where we would be drawing the curtain on today's show. Remember, you can get more of our programs via our various social media platforms and by sending in your comments also whenever the show is on, and also by staying tuned to this station. So we'll come your way again tomorrow with the Now Streaming Sports Special. Same time, same station. Do have yourself a blessed day ahead. I am Godwin Ujiri. Bye for now.